You ever think about that file your doctor keeps on you? It's way more than just a folder tucked away in a cabinet. It's a story. Your story, actually. And today, we're going to pull back the curtain on its secret life. We'll follow where it goes, see who gets to read it, and understand what it says about you long after you've walked out of the clinic.
It's a question most of us have probably had at some point, but we rarely stop to ask. You figure it's just filed away, right? Waiting for your next visit. But the truth is, the journey of your medical record is so much more complex and honestly, a lot more fascinating than you'd ever imagine.
Here's the best way to think about it. If your life is a book, your health record is its official biography. It's not just a random collection of scribbled notes. It's a detailed, chronological account of your well-being, all written by the professionals who are dedicated to keeping you healthy.
So let's go ahead and crack open this biography and see what's really inside. What exactly makes up this incredibly important document? I think the contents might just surprise you.
Okay, so let's start with the official definition. A health record is basically any relevant note a practitioner makes about your health that can be identified as, well, you. It's the paper trail, or these days, the digital trail, of your entire health journey.
And what's inside goes way beyond just a few notes from your doctor. Of course, you've got the usual stuff, handwritten observations, lab reports, x-rays. But did you know your file could also have photographs or even videos? It could even include data from a clinical trial you were in years ago. It's pretty much a complete multimedia profile of your health.
All right, so we know it's packed with all this information, but why is it kept so carefully? Why all the fuss? Well, this record has a job that goes far beyond just reminding your doctor about your last checkup.
This one document is an absolute powerhouse. Sure, its main job is to guide your treatment, but it's also working overtime behind the scenes. It's used to audit a hospital's performance, to help train new doctors, and it can even be used as evidence in legal cases. It even helps protect public health by tracking disease outbreaks. Its accuracy isn't just critical for you, it affects the entire healthcare system.
Now, when a document is that important, you better believe it's governed by some incredibly strict rules. You can't just scribble something out or tear out a page. So let's take a look at how the integrity of this biography is so carefully maintained.
And that's a fair question, right? People make mistakes, even doctors. So what happens if an error ends up in a file that's supposed to be a permanent legal document? Is there any way to fix it?
The answer is yes, it can be fixed, but there's a very specific process, and it's all about transparency. You can't just use whiteout. A single line gets drawn right through the mistake so you can still read what was originally there. Then, the correct info is written nearby, it's dated, and the person who made the change signs it. In your medical record, nothing is ever truly erased, it's just amended.
And that right there is the golden rule. Every single entry, every lab result, every little correction, it all needs a date and a full signature. This creates this perfect, unbroken chain of accountability. You can always see exactly who wrote what and when they wrote it.
This chain of accountability brings us to the big one, the question that probably matters most to you. Who actually gets to read this deeply personal story? Let's dive into the strict rules around confidentiality.
Generally speaking, your written consent is king. An insurance company, for example, can't just get your file unless you explicitly say it's okay. But, and this is a big but, there are some critical exceptions where consent is not needed. Like if a court orders the records released, or if there's a serious threat to public health, or in cases of suspected child abuse. In those specific situations, the law puts public safety and the legal process first.
Okay, so your file is created, it's updated, and it's protected. But does it stick around forever? Let's talk about the actual lifespan of your medical record.
So how long do they hang around? Well, the standard rule is that a record has to be kept for a minimum of 6 years after it becomes dormant, which basically means after your last visit with that doctor or hospital. But that's just the baseline. Get this. For certain health issues, especially things related to your job, like asbestos exposure where symptoms can take decades to show up, that retention period jumps to a staggering 25 years. That huge difference really shows how the rules are designed to protect you even far, far into the future.
And for that entire time, whether it's 6 years or 25, those records have to be kept safe and sound. We're talking physical files locked up securely, and any digital files have to be protected with passwords. Security is absolutely non-negotiable. All right, to wrap things up, let's flip the perspective. We've talked a lot about the rules for the people keeping the records, but what should a well-kept record actually look like to you, the patient? Here's a quick guide to what good practice looks like.
A high-quality record is thorough, but it doesn't ramble on. It always keeps billing information totally separate from your clinical notes. And really important, every single page is labeled. No loose papers just floating around. The notes themselves should be professional, without any personal or judgy comments, and this should follow a clear, logical structure. It's that level of organization that leads to better care for you.
And really, it all boils down to this one simple idea. This quote from the medical guidelines says it all. The quality of your medical record is almost always a direct reflection of the quality of care you're getting. Clear, organized, respectful notes are a sign of a good practitioner.
So, the next time you visit a doctor, just remember what's happening. Another chapter of your story is being written, a detailed biography of your health, with its own rules, its own secret audience, and a life that goes on long after you leave the building. So the final question is, are you an active reader of your own story?